2, Leaky Gut 2, the causes. Hi everyone, I'm Dr. Smith at the Toledo Family Wellness Center. Today, I'd like to review with you give you a general overview of the major causes of leaky gut. In later videos, I will talk in greater detail about certain foods that cause these problems. Some causes will totally surprise you, as they did me. The first and most obvious is diet for causes of leaky gut. No, do that over. The first and most obvious cause of leaky gut is diet. The American diet has too many offending foods, processed meats, processed carbs, sweets, from crackers to milk to hot dogs to wheat buns to chicken skin and fried foods, GMO grains and gluten. The diet has too few foods like wild-caught fish, raw seeds, raw nuts, non-starchy vegetables, fruit, grass-fed beef, organic chicken. That is an inflammatory combination that will just devastate the intestinal linings, and we're seeing it today. Gluten is the number one cause of leaky gut. It is the number one food sensitivity. It is in all grains, but similar compounds to gluten are found in other food. I'll talk about that in video number 3. But for right now, gluten sticks to the intestinal lining, and the immune system reacts with an inflammatory process that occurs, and then the lining breaks down, leaving small holes, thus leaky gut. Number 2 is dairy products. And then the next major cause or category would be stress. Stress leads to elevated various stress hormones. Among them is cortisol. We need cortisol to help us deal with our normal daily challenges, to adapt to them. But too often in the cortisol will decrease blood flow to the gut lining. Elevated cortisol will raise blood sugar, which contributes to a breakdown of the tight junctions, gut, and in general. The stress may be, The stress may be, The stress may be from bad relationships, work problems, financial problems, any negative influences. Okay. Number 3 is a decrease in sleep length or waking up more than once in the night. This causes a decrease of human growth hormone needed to build and repair the gut. Number 4 is physical overtraining will divert the body's resources away from the gut and raise cortisol levels. Infections, gut or elsewhere, raise cortisol. These harmful infections, such as bacteria, viruses, yeast, and parasites, will displace the beneficial ones in the gut that make enzymes, vitamins, help us with digestion and protect our intestinal and, in general, our health. Number 6, medications and antibiotics kill off many good bugs, but leave too many harmful ones behind. Number 7, deficiencies of testosterone in men and estrogen in women and thyroid hormone hinders the health of the gut lining, its ability to carry on normal metabolic processes. Number 8, high blood sugar Those with diabetes, those with insulin resistance, have elevated gut cell production of something called glycosylated end products that disrupt the energy and repair of the gut. People with autoimmune diseases like lupus and rheumatoid arthritis, celiac, Hashimoto's, MS have higher inducible people, number 9 over. People with autoimmune diseases have, number 9 over again. People with autoimmune diseases such as lupus, rheumatoid arthritis, celiac, Hashimoto's, thyroiditis, MS have a higher inducible nitrous oxide, which breaks down the tight junctions. Number 10, brain trauma. Even mild concussions from whiplash or sports injuries or bumps on the head cause decreased blood flow and function of the brain to result. Decreased brain function causes decreased activation and function of the brainstem areas that regulate the digestive system. Then we get less motility, we get less blood flow going to the intestines, and less intestinal health. Number 11, gallbladder dysfunction. The liver makes bile, and that goes to the gallbladder, which then secretes the bile into the small intestine to break down fats into tiny molecules of fat so we can digest the fat. If a person goes through times of diarrhea and the bile is lost, you know this you again you know this has happened if you get much do this again. You know this has happened if you get much constipation after you've had a bout of diarrhea. The fat-soluble vitamins A, D, E, and K will not be digested well without enough bile. The intestinal lining will become disrepaired in this situation. Number 12. Low pancreatic enzyme secretions, as in diabetics, will result in less than optimal gut health. Number 13, vitamin C deficiency. Vitamin C is a crucial part of the structural proteins of the tight junctions. Vitamin C is a complex of compounds. You need the whole food form of this from foods. If you get synthetic C in a supplement, you will only get ascorbic acid or something called ascorbate, which is a portion of vitamin C. It will not be, it will not be sufficient to build proteins of the intestinal lining. You get enough, okay, I'll do this over. It will not be a sufficient amount of vitamin C to build the proteins of the intestinal lining. To get enough vitamin C, you will need to eat a couple of helpings of high vitamin C foods like onions or parsley, green tea, citrus, cruciferous vegetables like Brussels sprouts, kale, cabbage, and broccoli each day. You need to get these factors checked out and properly remedied to get well. I go into more detail in this. I'm going to do this over.
How's it going?
Just about done. Okay, here we go.
You want to start over?
No, I'm just going to do the very last statement here.
All right.
Okay?
Yep.
Right after broccoli.
Cool.
Here we go. So with these 13 factors now, you see that there are many things that need to be checked. and therefore you need to make sure you get these checked and you get the proper testing, and then you need the proper remedy. So this becomes a complicated and a difficult thing to get better. I have more videos on this. I hope this helps. Until the next time, yours in health.
Okay. Perfect.
Okay. Yes. Okay. Keep trying.
Good job, Doc.